Genetic diseases. Genetic diseases are Mendelian disorders, chromosomal disorders, multifactorial disorders, single gene disorders with non-classic inheritance. Mendelian disorders are autosomal dominant inheritance, autosomal recessive inheritance, X-linked recessive inheritance, X-linked dominant inheritance, and mitochondrial inheritance. Autosomal dominant disorders: Marfan syndrome, Ehlers-Danlos syndrome, achondroplasia, neurofibromatosis, familial polyposis coli, polycystic kidney disease, autosomal recessive disorders, sickle cell anemia, normal red blood cells and abnormal sickle red blood cells are shown in that pictures. In B part, abnormal sickle red blood cells, sickle cells blocking blood flow. You can see in that picture. Cystic fibrosis, mucoviscidosis, organs affected by cystic fibrosis, nose, lung, skin, liver, pancreas, and intestine. Cystic fibrosis, hemochromatosis. X-linked recessive disorders are hemophilia, Wiskott-Aldrich syndrome, Duchenne muscular dystrophy. Chromosomal disorders are normal karyotype, chromosome identification and nomenclature, types of chromosomal abnormalities, numerical, aneuploidy and polyploidy, and in structure, deletion, inversion, translocation, isochromosome formation, abnormalities of autosomal chromosomes, abnormalities of sex chromosomes. Normal karyotype, structural chromosomal abnormalities, translocation. You can see in that picture. From chromosome part A, translocate to chromosome B, and chromosome B, one part of chromosome B, translocate to the chromosome A. It is also known as balanced location. Translocation you can see. Deletion, breakage in the chromosomes or deletion of any genetic material from one chromosome. Duplication, duplication of the genetic material. Doubling, inversion, paracentric inversion, breaks in the chromosomes and do inversion, reinserted piece of the DNA, and pericentric inversion. Inversion are of two types, paracentric and pericentric. You can see pericentric inversion breaks in the chromosomes, and then centromere you can see it's inverse and reinserted piece of DNA with centromere. Pericentric means with the centromere and paracentric means away from the centromere. Isochromosomes, you can see. Abnormalities of autosomal chromosomes. Down syndrome, 21 chromosomes trisomy. Its symptoms are like flattened nasal bridge, apicanthal folds, and brush-filled spots. Down syndrome, similar line and normal palm you can see in that picture. Edwards syndrome, small mouth, small jaw, short neck, occiput or back part of the skull is prominent, dysplastic or malformed ears, clenched hands with overlapping fingers, flexed big toe, prominent heels, shield chest or short and prominent sternum and wide set nipples. Edwards syndrome, Patau syndrome, small head, absent eyebrows, cleft lip or palate, dysplastic or malformed ears, clenched hands and polydactyl or extra fingers, undescended or abnormal testes. Abnormalities of sex chromosomes, 45X, Turner syndromes. In female, short stature, low hairline, shield-shaped thorax, widely spaced nipples, shortened metacarpal fourth number and small fingernails, brown spots, navy, characteristic facial features, fold of skin, constriction of aorta, poor breast development, elbow deformity, rudimentary ovaries, gonadal streak, underdeveloped gonadal structures, no menstruation. Klinefelter syndrome, XXY. There is frontal baldness absent, tendency to grow fewer chest hairs, poor beard growth. Some female characteristics are developed in the male. In Klinefelter syndrome, breast development, female type pubic hair pattern, small testicular size, long arm and legs, wide hips, narrow shoulders. Disorders with multifactorial inheritance, diabetes mellitus, hypertension, ischemic heart disease, gout, schizophrenia, pyloric stenosis, congenital heart disease, etc. Thank you for watching.